That's a good cue.
That's Commissioner Mortensen's calling card.
Good morning. This is welcome to the Cowlitz County Board of Health. We're going to call this meeting to order at 10:19. And I'm going to shift this over to Commissioner Dahl to do swearing in of the new Board of Health members.
Okay, in our previous meeting, our BOCC meeting, we announced three new folks. We received 3 new applications for appointment to the board. We reappointed Kelly Lane. We appointed Lorna Stewart, and we appointed William Youngren. So I'm going to have you meet me out here, and we'll swear you in, and then we'll seat you. All 3 of you at once. Okay, so when I say state your name, you don't say state your name. Okay. I state your name, do solemnly affirm that I will support the Constitution of the United States.
I, Lorna Stewart, solemnly swear to support the Constitution of the United States
And the Constitution and laws. And the Constitution and laws.
and the Constitution and laws
Of the state of Washington.
of the state of Washington,
And that I will faithfully and impartially. Perform and discharge. The duties of the office of Cowlitz County Board of Health.
the duties of the office of Cowlitz County
According to the law.
according to the law.
To the best of my ability. Okay, you're sworn in. Welcome. We'll sign these.
Do you know the seating assignment, Kelly?
Shall we sit here?
She will tell you in a moment.
Okay, so
I'm here.
you're here.
I'm here. Wasn't sure when I hear it.
There.
Thank you.
Just when you get in. Okay, it's back to you.
Okay, thank you for your patience on that. Welcome to the board, Lorna and Bill. They will be named cards, so it's official by the next meeting, I'm sure. Moving on to the next item would be to review the minutes. Everybody should have a copy of the minutes now. Does anybody have any questions or anything? If not, I'd like to entertain a motion to approve the minutes from May 28th.
So moved.
Okay, motion on the table is to approve the minutes of May 28th. Any discussion? All in favor, say aye.
Aye.
Hi.
Aye. Aye. Any opposed? No. So it passes. Okay. Next
Question?
item, yes.
Question, at this time, it seems like, I'm asking, not dictating in any way, shape, or form. Do we decide who the chairman is at this time?
I think according to the bylaws, we're supposed to elect the chairman the first meeting of the year. And so since it was done, since I was reappointed, it's the same guy. if somebody has a issue with it, we can redo it, but as far as I understood it, nobody said anything different.
That seems a bit strange because you could possibly not have been reappointed, in which case we'd have to.
At that
and-
point, yes.
And the
if-
level of ambiguity is a little bothersome there.
Yeah, no, I think if it was somebody else, we should probably revote. Does anybody wanna?
I'm perfectly happy with you continuing as the chairman.
You know, I would,
don't
what
see
I
a-
would do, let's make sure if the bylaw, if that's the bylaw says, we'll follow it, but we should check those before next meeting. And if it may, there's two ways it could have been worded, the first meeting of the year or the first meeting of the new board.
No, it was the first meeting of the calendar year.
Okay,
All right.
all right.
If David Berger is on, if he wants to chime in, let us know, but so should I proceed? Yeah, okay. Okay, so moving on to the next item, which we could have maybe Gina come up and kind of give us a little bit of a breakdown on the budget priorities list that we've been talking about for a few months. And I think she has some handouts for us. At the next meeting, we plan to go through all these items in detail, but it was suggested, a great suggestion, to hand out the materials beforehand so we all have time to review it. And then we can move on to the line by line items at the next meeting. So Gina, you like to tell us what you've done so far?
Yes, good morning. Gina James, Health and Human Services. Welcome new members to the Board of Health. Just a side note, we plan to reach out to our new members to offer an orientation to sit down with us and talk through our department, just to have a little introductory meeting. So keep your eyes out for that. We have been working on, we've handed out in the last few meetings some priorities from Health and Human Services. We've gone through and attached some potential cost, as well as some additional information about potential process, frequency, impact, et cetera. So what you see in front of you is, on the left-hand side, is just the priority categories that we had identified, the strategies that we had previously identified, and then some of the additional information. What I want to say about this is we look at this as a completely fluid, conversational document. So we are interested in getting feedback and input from our Board of Health, and in terms of what areas you feel like their priority may be, as well as if there's additional strategies or ideas that may not be reflected on here. We would love to have more conversation about that. So please don't take this as a set in stone kind of document. We want it to be fluid and as we have discussions. Some of the items, I'm not going to read through it verbatim, but we'd like you to have the opportunity to read through it and digest. And as the chairman mentioned, that next meeting, we'll have more opportunity to talk through and have discussion about the individual items. We're certainly happy answer any questions right now, or between now and the next meeting, we're available. I'll just stop there and see if there's any initial questions. There's a little button.
Push, yeah.
Got it. Now it's
There.
on. Thank you.
Yeah.
I just had a question. There's kind of four big categories that you have broken down. Are we obligated, I guess, funding wise, to have things in each of those categories? Or if we chose, could we put all of the funds into one category, or how? I don't know funding wise how that works.
Yeah, the funding piece is a little bit flexible. So those categories were our identified priority areas, not necessarily what the funding says. So those were our priority areas. And we've talked before too, we've talked about the foundational public health services funding, but there's maybe other funding that could be available as well. So those were just our priority areas. And before we leave, I'll hand out the kind of an overview of the FPHS funding that helps to talk about some of that piece if you want to learn more about that.
That would be great. So is some funding tied to like these specific categories? then?
There, in the FPHS funding, there is some allocated to certain categories. They're not necessarily these same categories, but there is some tied to communicable disease, for example, and there's some tied to epidemiology. And then there's kind of these broader buckets. So.
I'll say that just briefly looking at it without having time to really read through, it looks really great. There's a lot of, I'm really impressed by some of the stuff in here that seems to address systems and environment that will, I believe, have a really nice impact. I think our presentation last month from the youth, community prevention partners really made it clear that those one-time assemblies, scare tactics for kids for substance abuse prevention don't really work. So I want to make sure that if we're going to move down the assemblies and those kind of route, that we make sure we're touching back into what works for youth and substance abuse prevention. So I wonder what your thoughts are on that line item specifically.
Yeah, I think we were just sort of brainstorming ideas, and we certainly would want to move forward with something that first off is in collaboration with those groups doing that work and come to what that strategy looks like together. Yeah.
Anything further comment?
If I may, I think we should look at, there is no sacrosanct decision-making that will withstand through time regardless. I mean, everything's on the table. So one of the advantages of having new members is that they come in with other ideas and they may be more useful than the old ideas. So
Good point. And yeah, this is just the beginning, the overview. I think we'll put it as a big, take some time at the next month to really dive into it in depth. Okay, thank you very much for that.
Thank you.
Moving on, we're going to talk with about the school gardens project. Is Ian? There he is. Thank you.
Right here.
Please. Kelly, you have a presentation, I think, set up. Would you like to introduce yourself, Ian?
Yeah, my name's Ian Thompson, and I helped found the local nonprofit called Lower Columbia School Gardens. There was already one garden at North Lake Elementary that was founded like 22 years ago by some parents and some teachers. And my kids were going to elementary school there, and I kind of got roped in as a volunteer. And then we expanded that place to an acre, and then some other schools started asking for help. So we formed a nonprofit in 2010, and now we're in all 20 elementary middle schools in Longview and Kelso school districts. So, and before that, I was a remodeling contractor here in town.
We've discussed school gardens a long time ago. One of the reasons why it's coming under the Board of Health, which seems at first maybe school gardens doesn't make sense, but I think Ian's going to tell us a little bit about there is a lot of value for or a lot of relations to the health issues in that you're teaching kids about nutrition and That's right there is a big one. And then environmental health you mentioned.
Yeah.
So if you're ready, go ahead and start your presentation.
Let me just
Rick?
clarify, you're in all elementary and middle schools in Kelso and Longview?
Yes, public schools,
Wow.
yeah.
Okay.
Yeah. Just reached that landmark real recently with the new school they built in Lexington, in the garden out there.
Oh, okay.
But yeah, or not landmark, we made milestone, I guess you call that. And I'm really grateful to be here. And I'm really grateful for just the acknowledgement that it's, that it is health. And it is prevention. We are not really talking to kids about drugs out there, but it's sort of the positive thing before that. It's sort of like, healthy, active stuff for people to do, for kids and families to do that are free, that are, a lifelong activity that they can do, and learning to cook and grow their own food and have a positive relationship with, fresh, healthy foods, that whole thing. So, yeah, I just really appreciate that. And I think in our journey in the community, there has been, when we approached like the Healthcare Foundation for funds and, Peace Health, there was initially, they were like, well, it's not really medicine. It's not really fixing people when they're sick. So, but then there's been sort of this understanding of like upstream health and, having people have a healthy life and a healthy community before they're sick. And, maybe we should put effort and dollars there as opposed to just, medicine and Band-Aids after the fact. So I really am super grateful to be here. So.
Thank you for coming.
And can I just there's kind of a lot of slides. Do you want me to say next slide every time, or can I give you a thumbs up or? Okay. So next slide. And as for a lot of these, yes. So just a base timeline, I guess I sort of already went over this. Yeah, it was a Kaiser physician, family physician, Leanne Geekus, and her daughter was going to Northlake Elementary, and together with some other parents and some teachers, they were kind of like emulating a program in California called the Edible Schoolyard. But they just, got some donations and had some work parties and created this garden. And for a number of years, that was the only garden in town. So next slide, please. And this is Northlake, which is, we as a nonprofit don't have our own space. We have a classroom and one of those little portables. So in 2010, the garden on the left was the original garden. And then we looked out at this big grassy field and said, can we plant some more fruit trees there? And the principal at the time said yes. And so that off to the right is an orchard. So this is like probably 2010. And so next slide, that's a couple years ago. But that's an acre, and it's sort of turned from an orchard more into like a food forest, if you've heard that model, where there's sort of all kinds of food plants growing together. And it's really become, public schools are sort of community spaces, families come in to use the playground and whatever. So we really have connection with almost every family, that has kids and even families that don't. Anyways, so this is like a place that people come for all sorts of reasons, but it's where we're based out of, and then out of there we serve the other 19 schools. Next slide. And just a little bit about our nonprofit. There it is. And, a common misconception we hear a lot is that's great. What the schools are doing, they have gardens in their schools. And while the schools are a great partner, it is the community that's doing it. So it's a community nonprofit. We're begging for, most of our funds. Districts are less than 5% of our budget. And so anyways, just to sort of, that's how it works, but it's just, they're all on, school property. Next slide, please. And we used to put this, why school gardens? Why would we do this? It's a lot of work and it's messy. We used to put it into 3 buckets and we have since thought of a few more. But next slide. One thing is that kids are working and they're outside. They're doing things with, they're using their bodies, they're using their muscles, they're using tools. They're doing things that mean something. They're working on a goal that has, that's meaningful. People are being helped by it and they're proud of that. Next slide. And that's St. Helens Elementary. And I think for a lot of us, we need to just sort of remember that we all don't have the same access to stuff. And a lot of kids don't have a backyard and they don't live in a household where they go places. They don't go to Willow Grove Park. They don't go to the coast. They don't go to take a hike or something. They don't get out. And so if you are in, if you then go to this school and your playtime for 6 years is working with the same plastic equipment that's bolted down that can't be, interacted with creatively, there's just not a lot of outlet for kids to be kids and do what we're supposed to be doing as kids, which is playing in the woods with sticks and mud. So this is these kids digging in this kind of sad, dead soil. And that's the best thing that they've got. So next slide.
So that was their natural, they were doing that on their
Oh yeah,
own.
that was the kids' thing. And I'm sure they got yelled at, don't wreck the beautiful grass. But that was a lot of these kids every day, they just met at the dirt hole, But kids, they're not lazy. They like to work. They're thrilled when they have a job that's meaningful that they can get into, and learning skills, using different tools. So many kids haven't touched a hammer or shovel or a wheelbarrow, and they just get a lot out of that. Next slide. Yeah, just gaining skills and confidence and self-esteem, being able to do meaningful things. Next slide. And next slide. We do a lot of this in the school gardens, cardboard and wood chips. We get wood chips from the city and arborists to maintain the gardens, and kids are a part of that, Next slide. You can't really tell, but it's raining this day and kids do not care about being out in the rain. They're happy to be out there working. Next slide. And kids get to, that's Huntington Middle School 11 years ago. But kids are a part of building the gardens, and the gardens are never finished. There's always projects going on that they can interact with. And so letting kids, use tools and do real stuff is a big thing. Next slide. And then another thing is just the way that kids learn. And again, the way that kids and, humans are wired to be able to be touching things and discovering, a lot of times in the classroom, that's a really tough environment for kids where it's all paper worksheets, you're kind of staying in your desk, not a lot of moving around. And so when kids are in the garden, they don't think of it as school, but they are, they're just doing what kids are supposed to be doing, which is learning, and asking questions. So next slide. Next slide. And you don't really have to coerce them. They already naturally know what to do. They look at stuff, they ask questions, they dig up things. Next slide. Next slide. Next slide. Next slide. Next slide. You can teach any subject out there, not just science and nutrition, but math. And I could use a little help in knowing where I am with time. Okay. Maybe you could give me like a 5 or 10 minute warning. Okay, appreciate it. Next slide. And they're also just spaces where kids can just sort of be kids, like I was talking about. This is, again, Huntington, and this was a group of kids, middle schoolers that wanted to build a big structure for beans to climb up. And so we cut down some trees at the edge of the grass with handsaws, and they peeled off the bark, and they built this teepee, and they had a government. There was the Society of the Bean Lodge, and there was a president and, officers, and there was all these meetings about mixing. Those are custom mixed colors of paint. And there was all these meeting about, what colors and what the order of the colors should be. And not that this happens every day in those places, but just that it's a context where that kind of stuff can happen, and the chickens were just, one of our volunteers just brings chickens sometimes. Next slide. And then really important thing that's happening is that kids are learning about real food. And this, again, I think it's really important to remember a lot of kids' experience. They're in a household, and sometimes their parents and maybe their parents' parents were also in a household where people are not cooking. People are not taking ingredients, chopping them up with a knife and stirring it around in a pan and making food. The kids have literally not seen that happen. And so if they're eating stuff from like a corner store or fast food or whatever, and then they get to school, and I'll just speak for Longview School District, lunch is sort of like assembled in a central kitchen, and it comes in plastic packages to the individual schools. Kids sit at their desk, they open a plastic package, they eat it with plastic forks, it goes in the garbage every day. And then they go home, and if they're having the same experience, they really have not had it. And so they are flabbergasted that I can pick that thing off of a bush and eat it. That sounds weird. Are you sure that's safe? And so, but once they get it, it really is miraculous. And, we have all heard you should eat more fruits and vegetables. Like, everyone has heard that. These kids have heard that, and hearing it another 1,000 times might move the needle a little bit, but this is like exponential. It's just, it literally, kids will, and their parents will say, how did you get my kid to eat this? Because my kid will not, this kid will say, I don't eat anything green. I don't try new things, but their friends are eating the stuff, or they've planted the seed and they've cared for the plant. We say, do you ever eat flowers? They're like, no. And we're like, do you know that broccoli, when you eat broccoli, that's the flower of the plant. That's what part of the plant it is. And also those little green, buds that you see, those open up into this yellow flower. And in the garden, it doesn't happen in the grocery store, but in the garden, these little flowers open up, and you can eat them. They're delicious. Kids think they're very cool for eating flowers. And then they look next door, and there's a kale plant, and the kale flowers are even better. And then you have like a group of small children that are like locusts devouring raw kale, devouring these plants. And that just doesn't happen without that sort of exposure. If it's on your lunch plate, it's not the same excitement. And we don't even have to lean on kids. Hey, you should eat healthy foods. We have to be like, you need to save some carrots for the next class. You guys need to slow down. So it's awesome. And, the main rub with this program is just trying to get all those kids out to these gardens with limited staff and limited resources, and teachers that are so strapped with all the stuff, all the hoops they have to jump through in their daily. Next slide. Yeah, so every time they're out in the garden, they're tasting, that looks like radish flowers, which are great. And yeah, just kids being adventurous eaters, celebrating what's in season, Next slide. Next slide. Next slide. And this is funny and sad and happens all the time, but kids look at a potato coming out of the ground. First of all, they're like, why are those in the ground? And then I would never eat anything like that. Are you kidding me? And we're like, have you ever heard of French fries? They're like, wait. So next slide. And there's only so much you can eat raw out of the garden. So we're also teaching cooking. And you can't really cook much without using a knife. So we teach kids to use knives. And next slide. Next slide. And this is like a beautiful thing that happens and kind of a good example. We try to plant asparagus in all these gardens. And we'll have like 10 kids and 9 of them have never heard the word asparagus. I have no idea what that is. And then we, harvest it from the garden, put it on the grill with some olive oil and salt and pepper. And at the end, they all love it. And we literally hear from their parents, we were in the store and my kid said, we need to buy that stuff. It's really good and I know how to cook it. And so, yeah, thank you. Next slide. Next slide. And then this is sort of one of the other reasons that we've learned, and this is like the social emotional health. And we hear from schools, especially, with the extra stuff around COVID, just that kids aren't gonna learn math. They're not gonna do well in school if they're not feeling okay. And like being in nature, smelling some rosemary, digging in the dirt, that sort of stuff is a thing that really helps. And we have, we see people from, school counselors, administrators, folks from Core Health, Youth and Family Link that are at the schools. Kids will be having a bad day and they can take them out to this garden and they come back, having a much better day. So it works that way. Next slide. Next slide. Next slide. Yeah, just that this is St. Helens. Kids opted to skip recess to move a mountain of gravel, which they loved, and they were sad when it was gone. And they have, ownership. Kids in the neighborhood have ownership over these gardens and kind of look out for them. And there's we have incidents of vandalism here and there, but there's really kind of this culture around them where the neighborhoods kind of has ownership and is looking out for them. So it's pretty good. Next slide. That's that same garden a little later. And just to say that these aren't like just a garden plot of veggies, there's fruit trees and grapevines and herbs and pollinator gardens and all that, native plants. Next slide. You can just kind of keep going. This is the new one at Wallace. You can keep going with slides, just sort of new garden at Wallace Elementary. Summer school kids helped build that garden and plant that garden, which is a really special thing because the kids that are there for summer school are the kids who really need that extra intervention. Turning in a cover crop after the first winter, 5th graders planting fruit trees, just kind of a legacy thing to do, This was what we looked at Lexington when we arrived. And so we had to bring in a lot of extra soil to basically build an island, but that garden is now up and going. Next slide. Next slide. And I'll just say that, right now they're open to the community during the summer. And right now they're like 4 of them are open as we're speaking. And I just got a text from a coworker who's at St. Helens Elementary and they're picking cherries and a bunch of families have showed up. So that's a thing that's happening, right now, an activity for kids. And so, yeah, I guess I'm just really hoping that folks can see the value. And maybe we could just actually, next slide, kids taking a foundation for this structure. Next slide. Next slide. Next slide. We'll just stay there for a minute. So, just this idea of, like I said, of prevention, just that there's this positive thing to do. And I guess what I want to communicate is that these programs are very unique in that it's not just a program. The garden is the program and the garden is alive. Whereas if it was a sports program or an arts program, if you don't have the funding, you can put your supplies in a closet. And when you get funding, a couple of years later, you can dust it off and bring the program back. But with gardens, you can't do that. They closed the school at Beacon Hill. We turned our back for a couple of years and came back and there was no garden. It was Canadian thistle, 5 feet tall, and you could see a few fruit trees, but there was it would be starting from scratch. So it's really important that there's continuity. And we're in touch with programs, across the nation. And it is a constant struggle. Some teachers and parents get excited. They start a garden. The teacher retires. The parents' kids are done with 5th grade. And so they move on. And the weeds grow over the summer. And the district says, we can't have this big mess. And it gets bulldozed. And that happens. Every district has that story in their history. And the places that it's working is when there's this partnership with a community group. And we somehow, little old Longview, Kelso we have people from around the region coming to ask how we're doing it, because what we have is not what most people have. There's not, most communities don't have a garden in every single school, this robust and stuff. And so we've been able to get funding to build these gardens. And now that we built number 20 and that's our scope. We're gonna, maintain and do all these programs and make sure they're thriving for the community and the students. We're having a really hard time funding that now. Other granting agencies sounds like you got it covered. We're gonna go fund this emergency, and so that's what we're up against right now. We're really looking to try to figure out how to fund this. And so that was why, it was part of why we appreciated seeing school gardens in that recommendation or whatever a couple months ago at your meeting, because it really is a part of health for our community. So I guess I'll stop it there, and maybe if there's questions. Yes. Can you hear me? Yeah, I can. I'm really impressed. Thank you. This used to be the norm where people would have little mixture gardens. Right. And they would teach the same village how to can. Yeah. They think there's been studies where they 1 in 3 families and a garden like this.
Money important. Thank you.
Yeah.
And so I appreciate what you're doing. It's really important. And are you tied to the extension services and Master Gardener program?
We partner with them in some ways, and we're working on expanding that partnership right now, but there's some. Could you do a couple more slides? I forgot there's one part of it I wanted to share about the fact that we share food with the community. I don't know if you've seen these free farm stands. We used to do produce sales, but now we're giving away about 6,000 pounds of food. You can just kind of burn through those until we find the right. But anyway, so just that we're providing extra produce for families, but also plants and seeds so that they can grow at home, and these kids are taking that knowledge home and they're able to do it at home, whether it's a container on the porch or whatever. Next slide. That's one of our farm stands. Next slide. And that's, now that we're in the season, that's going on right now. And those are, like I said, strategically located, South Kelso, 2 in the Highlands, 1 at Barnes. But yeah, we're with you there about it. I'll just say we did not invent this idea. It's sort of a reaction to where our society is, that this needs to be a program, where it's supposed to be part of life, living life on earth. People are working with the plants are helping the people. It's just like a thing that kids deserve to be a part of.
Boy, Mr. Thompson, I'm impressed. Thank you. I said to somebody, oh, I was visiting WSU there. I go over and visit with them every so often, and they were talking about their master gardeners. And I said, I made the comment, I said, I can't ever recall seeing my grandparents having canned anything. You know, they grew and they, and they can their own stuff, but stuff from a store, I don't ever remember seeing that kind of thing. And as you described, kids these days don't get it. And the things you do, this is one of the things and I've said before, I said, you know, people look for government for solutions, and we're really not a solution agency. We put more roadblocks in the way that we do solutions. Solutions come from the people, and what you're doing is tremendous. And I thank you for that.
Appreciate that.
Just one question and a comment. Do you do any homeopathic herbs and plants?
We do, yeah. I mean, I guess we don't use the word homeopathic, but we talk about, we talk about medicine.
Medicinal?
Yeah, and a part of, some of that is a partnership with the Cowlitz tribe that's been happening for the last number of years, and planting, you know, plants that are indigenous to this area, and what did the people that have always been here, what do they use this plant for, you know? That kind of stuff. So we do talk about that stuff, and just, you know, basic stuff that I hear kids repeating, you know, telling their friends, oh, you know, if you're sad or stressed out or whatever, you should just smell some lavender, you know, or some rosemary, like kind of telling each other.
That's great. Just a couple of notes that I wrote down is teaching them cooking and nutritional value. It's all gonna, and just working in the garden is all gonna help the mental health of these kids. I think it's a great program.
Don't have much to add, but to say that concur with everyone. I mean, in the tribal community, we talk about food as medicine all the time. So there's no doubt in my mind that gardens are part of healthcare. So I know that's kind of where we started this conversation. And prevention. We know that culture is medicine. And like Ian just mentioned, we've had a partnership with them doing indigenous plants and including the Cowlitz culture into the garden. So that's there as well. So everything from physical activity to healthy eating to social wellness is part of the garden program. And in the tribe, our garden is actually under the medical clinic's management. So we fully believe that. We know that food RX programs are work, and that gardens work for benefiting community health. So yeah, thanks, Ian, for your presentation today. I think it's really important for everyone in the community to know what you're bringing to our youth here. And I know that the work that the tribe does really goes hand in hand with what you do.
Sorry, Kelly. You heard in a previous meeting, we had a citizen ask on where we're at on working on trying to utilize some excess space at juvenile for some adolescent help. And we had a couple of our people visit a facility over in Spokane that's really put together by, I think, 7 tribes over there. And one of the big pieces to it that is, we feel has created the success that they've had over there is the kids have projects where they have music projects, or they have gardens, or they have these type of things. So I think the comments on the long-term mental health of these kids, it'd be interesting to track them, because I would almost be certain that they're going to be easier. It's going to be easier for them to deal with things that come before them than some others.
Yeah, I appreciate you saying that about mental health. It's real, and we also, I mean, part of our thing, you know, we have garden agreements, you know, walk in the garden, and one of them is take a deep breath, and we talk to kids about, you know, how to feel calm, what to do if you're feeling anxious, that sort of stuff. And we do hear kids saying that those tools, you know, are helping them, and just recognizing, you know, kids recognizing, wow, I feel really good right now. I'm just digging in the dirt. I'm talking to the person next to me. I feel really peaceful right now. And just recognizing, note to self, you know, and nobody's talking about drugs. Don't do drugs. Nobody said that. But what we're finding is, here's a thing that makes me feel good, you know, that's productive and helps me connect with people and stuff. Yeah.
I'd point out too, in all those pictures, I didn't see any kid with a cell phone.
There is, I mean, there is that, just doing something outside that's not, screen time. But for a lot of kids, that is, like, that means do sports. And not every kid is gonna do sports, they're, and not, or they're gonna try and they're not gonna be very successful. And what's cool about the garden is that everyone's successful. But yeah, it's like, what sort of active activity can you be doing? And a lot of times you see kids looking around at kind of a bleak landscape saying, what is there to do? And look at all this cool stuff on my phone. So yeah, it's real.
So just a top level comment and then a question for you. I have a holistic view of the world, and this program is teaching kids disciplines across many areas, and they're learning by osmosis, which is something you said essentially. You learn by being involved in doing, and I call that osmosis. Today, you're going to learn the chemistry of plants. Doesn't go as far as
Exactly.
you fertilize it with this and it didn't do well, but with this it did do well, yet the other plant, and on and on. So I think the holistic view of that is utterly amazing. So I don't look at it as just a board of health issue. It's actually the health of the society. Okay,
Wow,
so
yeah.
So the question I have is, clearly what you've done is very well done.
Mhm.
How can we help without destroying it? Because government has a way of destroying things.
Well, you could find us some money. Is basically the main, I think that's the main thing. We have a lot of great systems. We have a lot of volunteers, but there's only so much volunteers can do. And volunteers turn over and someone has to be there, to recruiting and all that stuff. So we have systems in place. That's sort of what I can think about. But I also just feel like just sort of the awareness and the advocacy that, it exists and it's a resource. And we do find that there's like infinite ways to connect. Like almost every program we talk to, YMCA is going to come do something with us. Like the prevention folks, like we're partnering every time we turn around and just remembering that as a resource,
How would you use a chunk of money?
Well, that's the thing, not in any really exciting ways because, well, I mean, it's exciting to me, but all the exciting ways are kind of used up. We're building a brand new garden. These, 400 kids haven't had a garden, and now they will because you're going to give us this grant, or we're going to build a shed, or we're going to build, a thing. And we have, because we've chosen to spread wider.
If I might interrupt you, the issue on something like that is, and I'm not sure how this plays in with you. If you mentioned there was a garden that was abandoned for a year and then or two, and the thistles were high. In the real world, somebody doesn't just come in with a bulldozer and set everything up for you and dig and say, okay, now you can plant. You actually have to start with the idea and then the elbow grease. I don't think we want to shortchange that. So I still want to know something more specific. If you got a chunk of money, how would you use it?
And I've had the job, I don't have it currently, but I've had the job of raising funds and advocating for money, since we started to try to get this thing going. And I know, like most of the time, I'm saying that I'm gearing my responses towards people. When we say what we need help with is funding our bare model, just the model to do the stuff that's happened, just to have the gardens exist, to be, to have someone who is coordinate, our model is garden coordinators. So one staff person is basically responsible for 3 or 4 gardens, and they interact with the teachers. They do outreach for families. They lead classes. They lead volunteers, that sort of stuff. So we are in a place where we're not able to pay for that stuff. And we just had someone leave to go do a different job, and we were not able to rehire that position. So we are basically scrambling to be able to just maintain, and we're looking for ways, and we're you know, looking in all the places, but we're looking for ways to be able to maintain, to keep this beautiful thing going. And right now it's kind of sketchy. And so there are grants out there that we could apply for to do something new, but you know, that ends up being mission creep, where now we're doing all these things that aren't part of the basic mission, but it's how you, but if you want the $100,000, you need to apply for it. So we're at a place, we've arrived, you know, after building these 20 gardens at a funny place, and we have multiple funders say, you know, we're not going to fund you anymore because you're not building anything new. So are you
Yeah,
asking if
no,
we're going to
well,
build something new?
I'll try to give you my jaundiced view of, I started, I was saying, how can we help you without
Yeah.
destroying you? As soon as you collect money to pay for volunteers, they're no longer volunteers.
Mm.
And that's how the changing, the transformation happens, when it was something that was beautiful coming from the people now becomes something from the government.
Oh, I think I see what I think I see what
But
you mean.
if you said, look, we could buy a little tractor. Kids could learn about what keeps a tractor going while they can dig a post hole.
Yeah.
And we need more shovels. We need more of those garden
And-
tubs, stuff like that.
Right, and I just want to say that we have all those things. We don't need any more shovels. We need to be able to pay our 6 staff who are somehow managing 20 gardens. When people come out and see what we're doing, when volunteers come out, they're like, how is this happening? You know, how is this possible? You know, you have 250 fruit trees out there and 300 grapevines and, you know, hundreds of raised beds, and you have 6 staff, you know, and 6 staff are not doing all that work, but they're coordinating volunteers. I don't know if you've done that work, but that is a piece of work in itself. So that's what I'm talking about. And there are like lots of easy grants to write for a tractor, which we don't use tractors in our gardens. There's not really room. You know, shovels, raised beds, there are grants for that. That's not the help we need. So, and it's really hard for me to say that because my job is to try to get funds for this organization to keep this work going, but that's not the help that we need. So it's just to sort of pay the basic bills, and we've scaled way down on some really cool stuff. We're doing less cooking classes. We're doing less fun stuff because we've chosen to spread wider, because, you know, it's not fair that kids at these schools don't get, you know, this opportunity or whatever. So that's where we're at. But
So
hopefully I'm hearing you right.
changing focus for a moment, a thing I starve for up here is information now. I'm very comfortable with what you're doing because it feels like it's human nature that you're
Awesome.
exalting, and that is always going to be successful. I am concerned about stuff in the future, and I think you have an opportunity to collect the data. Like, I would like to know how your 2019 students who are now maybe juniors in high school think about the program, and keeping that data handy over the years is something a lot of organizations don't do and should do.
We have some of that stuff. We've done some evaluations over the years of you know, impact on kids and surveying teachers and that sort of thing, focus groups.
And then
We have some of that stuff we could share.
okay, that's for, at some point, that'll be a part of how you can continue to go and prove that,
Right, no, it's true.
because not everybody's going to be as believers as we are when the.
Right, people say, show me the numbers. Yes, I'm aware of that dynamic. Yeah.
And then there are, the herbal stuff was mentioned, but I think many of us are not very good at surviving because we don't know if you can eat this, but you can't eat that.
Mhm.
Do you do any of that?
Yeah.
Identification of beneficial weeds?
Yeah, we do. Yeah, absolutely. Dandelions and yarrow and mullein and yeah, all that stuff we do. And that's a big part of it. you know, you can't tell kids you should eat plants without, you know, first you should learn what the plants are, you know, and sort of this idea of having a relationship with plants. And that's something that we're getting from, you know, the Cowlitz tribe, and that wisdom of like considering plants relatives and entities that have wisdom and lessons to teach us. You know, what can we learn from this, from the willow tree? You know, it's flexible. What can we learn, you know? And sort of learn, anyways, just like learning these plants, and like, you know, it's almost like they learn rosemary, you know, and you know that every time you go by rosemary, you need to like take a few leaves and smell them, and, you know, say the name rosemary, and then that's your friend for life. You can move to another state, but that's like somebody that you know. Anyway, just to say that that's part of that whole thing, foraging. And we're actually, we had a mushroom, we have guest farmers come into the schools sometimes, and a variety of different farmers, herb farmers, but this one, they grow mushrooms in St. Helens, Oregon. And they came over and, you know, showed the kids a bunch of the mushrooms. We cooked some and ate them. They helped us inoculate some wood chips with some spores, and they're growing King Stropharia wine caps right now. And they're, you know, but they are learning very, you know, this does not mean that you go out and eat any mushroom you see, because that's not a good idea. But the power really is in knowledge, in knowing, you know, and they can realize that a lot of times I'm walking down the street and I'm literally walking by free food. Some of it is weeds, you know, considered weeds or whatever, but yeah.
I just want to say that like I definitely hear you in the need for staffing as someone else who's run a garden. And I don't think that takes away from that feeling of community or that volunteering, like
Right.
Ann's trying to say. I think it is really critical for gardens to maintain that staffing. I know that the tribe went forward with it. One of the main criteria is we need at least one full-time, you know, and then you grow and you need more staff to coordinate. And the community is still heavily involved, like it is with Lower Columbia School Gardens, I believe. But without that funding of staff, it becomes impossible to manage these things, or these volunteers, or the equipment or supplies that you have, or even to do that evaluation work that is so critical, right? Like oftentimes I think we skip that because it takes funding to do it and you need it for the funding. So it's this like vicious cycle. So I just want to say I hear that, and I would support as a Board of Health member finding ways to make sure that that basic framework of funding remains in place, based on what I know about gardens and health, and especially in our local communities. So
We do have a couple hundred, it fluctuates, but I think, you know, last year was 300 and something volunteers total. And yeah, that just takes a lot of managing, and you can't fire them when they don't show up or when they're late or.
Well, thank you very much for your presentation. Thank you for
Wow.
coming.
Yeah.
Yeah, really grateful for the opportunity. Thanks so much. Nice to meet you all in person.
Nice to meet you too. We'll be in contact and going to be
Sounds good.
discussing the funding that you just mentioned, Alyssa. So at this point, I'll go ahead and open it up for public comment period. One thing though, Alyssa, were you able to talk to the tribes yet?
not yet. Sorry, I have not heard back. There's
Please
only so much
do.
I can do.
Want to meet with them, especially after hearing Mr. Thompson's working with them as well. That's another part I didn't even think of, working with the Indian tribes on medicinal plants. Please go ahead. Lynn, sorry.
Thank you. I can't say enough good about the school gardens. I was able to volunteer for a couple of years while I served in AmeriCorps and be involved year-round as they engage the students in planting, picking, cooking, learning all about the plants. For one of our AmeriCorps projects, we headed up a project for the school gardens, and to see this man take just a plot of land and make it into just a beautiful setting, utilizing the whole area around the fence line, growing plants everywhere. It's pretty amazing what they can do. Everyone is enthusiastic and energetic. It's a fun place to serve. And if you haven't been able to volunteer in the garden, I suggest you go try it out because you will be hooked. It's really fun. The people are engaging, they have well thought out plans, and they get things done really well. So I want to thank Ian and his team. They do a fabulous job.
Thank you. Next.
Just had a question from the gentleman that gave that wonderful presentation. I think that school garden is a wonderful, wonderful thing. When do they normally stock the garden stands at the school?
You can come right to that microphone, please.
There's, first, one thing that we're advertising right now is sort of calling it U-Pick as a way to get volunteers and community members to come through. So like this week, we're talking about all the gardens that have cherry trees and people are coming to pick the cherries. So just showing up to our community days, which are, we have schedules posted on the internet and other places. It was in the Daily News this morning. But basically all the gardens are open one day every week. So like I said, there's 4 of them going on right now. So you could walk into one of those gardens, say hi to people, eat some strawberries, go home with some cherries and some lettuce or whatever's growing, whoever kind of shows up, whether they're there to help or not, can take home some food. So there's that. But the farm stands at North Lake Elementary, that's every Friday, on Olympia Way, kind of by the library and the college. That's every Friday at 10 a.m. And then the other ones are Thursdays. And I think we're rotating between Longview and Kelso. So those dates are on our website, but Thursday mornings at 10. I believe that this week that is Wallace and Barnes Elementaries will have them. And then next week it'll be St. Helens Elementary, the Highlands Neighborhood Center, and one of our staff who lives on Oregon Way has a stand in her front yard. Thursdays at 10. But anyways, the easy answer is to, or not for everyone, but go on the internet, look up school gardens, and they're all on the schedule there.
Thank you very much.
Did that help?
Yes. thank
Okay.
you.
Sorry.
Thank you. Next.
Thank you, Commission. My name is Bob Runnels with Informed Choice Washington. And I am also very happy to hear about food forests in Cowlitz County for kids. That is awesome. There's a lot to be learned from that. I personally had my head in the sand for, say, 30 years in terms of what public health policies we're doing. And I'm not going to stick my head back in the sand after being kind of disturbed and watching the whole world go to the one direction and believing what things were told to them. And now we've got some forensic data, which is a little more stronger than science, I think. Data showing that the policies were possibly very ill-founded. And there has been comment in this Board of Health, in this forum before, that said, well, there were only just a couple vaccine deaths from COVID vaccine. Well, hot off the press this week, I'm bringing 9 scientists with me who wrote this paper. It was submitted to the Forensic Science Institute, or sorry, Forensic Science International last October. It's taken 9 months to get this through peer review, and it's about to be published. This is a pre-production copy. By the time you get back to your computers, it may be published. And so the title is A Systematic Review of Autopsy Findings in Deaths After COVID-19 Vaccination. Written by somebody who works at the Michigan School of Public Health, a bachelor, probably did all the heavy lifting, but then there's a PhD and an MD 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 PhD and an MD and an MD MPH who wrote this paper. So I'll just read the summary. I'll summarize the summary so we don't belabor, and I'll leave the copy with your executive. The rapid development of COVID-19 vaccines, combined with a high number of adverse event reports, have led to concerns over possible mechanisms of injury, including systemic lipid nanoparticle and mRNA distribution, spike protein-associated tissue damage, thrombogenicity, which is blood disorders, cardiovascular disorders, immune system dysfunction, and carcinogenicity, causing cancer. The aim of the systematic review is to investigate possible causal links between COVID-19 vaccine administration and death using autopsies and postmortem analysis. This is pretty much the study the CDC doesn't want to do. They searched PubMed and ScienceDirect and all published autopsy and necropsy reports relating to COVID-19 vaccination, and this is up through May of 23, so about a year ago, but all the way through the vaccine program start. All autopsy and necropsy studies that included COVID-19 vaccine as an antecedent exposure were included. So 3 physicians independently reviewed each case and adjudicated whether or not COVID-19 vaccine was the direct cause or contributed significantly to death. They found 678 studies in the initial group, but they looked for qualifying factors, and so they really went from a population then of 325 autopsy cases and 1 necropsy report. The mean age of death was 70 years. The most implicated organ systems among cases was the cardiovascular at 50%, hematological 17%, respiratory 11%, and multiple organ systems 7%. 3 or more organ systems were affected in 21 cases. The mean time from vaccination to death was 14 days. The most deaths occurred within a week from the last vaccine administration. So a total of 240 deaths, and this is about 74% of the population, the N number, were independently adjudicated as directly due to or significantly contributed to by COVID-19 vaccination, of which the primary causes of death include sudden cardiac death at 35%, pulmonary embolism 12.5%, myocardial infarction 12%, VITT, which is vaccine-induced thrombotic thrombocytopenia. Look that one up, that's 8%, so basically a blood disorder. Myocarditis, 7%, multisystem inflammatory syndrome, 5%, cerebral hemorrhage, 4%. So if you go back to the numbers that have been cited here many times, the OpenVAERS or VAERS data in terms of reported deaths, which arguably, and very arguably, is underreported. There are currently 37,647 VAERS deaths reported as suspected relationship with the vaccine administration. Take 75% of that roughly, or the rate that they found, that's 28,000 confirmable vaccine deaths. That is something to be concerned about. I appreciate this committee's, this commission's skepticism of public health policies, how every county in the country was forced or went to one direction with one solution. So I'll read the last conclusion. The consistency seen among cases in this review with known COVID-19 vaccine mechanisms of injury and death, coupled with autopsy confirmation by physician adjudication, suggests there is a high likelihood of a causal link between COVID-19 vaccines and death. Further investigation, that's what most papers have in there because they'd like to find that mechanism, but this one is a causal link. And that's all I have for the day. Thank you.
Thank you. You're going to leave copies to the clerk, you say?
It's 61 pages, so I just don't want.
Okay. Thank you. Any further comments or questions? Okay, with that, one more comment here.
Can you hear me?
Yep.
Okay. My one question to the gentleman about the gardens, what was his name, Ian?
Ian.
And on the fruits and vegetables, the seeds they use, when they grow the new crop, do any of them have seeds in them too?
Hello. I guess I didn't turn it off last time. Yeah, we save some seeds from some plants. That's trickier with some, but like, beans and sunflowers are really easy to do that with.
Mm.
But yeah, and I don't know if you're interested in growing stuff, but we end up getting a lot of seeds. Stores can't carry last year's seeds, so, Walmart and all these big stores will give us their supply of seeds from last year, and then we give those away. We actually have a little order form where you can say, what kind of seeds you want, and we'll like put them together and leave them out for you. So I don't know if that's helpful.
I wasn't sure if I heard this or not,
Yeah.
but anyway, does any of these things actually go to any of the supermarket or the food stores around here?
Not food stores. Our food goes to the farm stands I talked about. We supply Radical Love. They make meals for homeless folks out of St.
Is it
Stephen.
Longview?
Radical Love, that's in Longview. And then the Family Community Resource Centers, which are in Longview and Kelso school districts. We supply those folks with food. Ethnic Support Council.
Okay, because excuse me, I've never heard of these organizations like Radical Love. I've never heard of it before. So thank you for that information.
Yeah, you bet. I will try to find a card or something if you want
Okay.
to, more information on stuff like that.
All right, thank you so much.
Yeah.
Thank you.
I haven't went through all this, so I have no more for now.
Thank you for the comments. Okay, with that, no hands? Okay, with that, I thank everybody for coming and bearing with us, and we'll adjourn the meeting at 11:31. Thank you for coming.